If you are a woman navigating the profound journey of life beyond the age of 60, I want you to pause for a moment and truly listen, because the information I am about to share could fundamentally change how you view a deeply personal and all too often unspoken part of your health and well-being. Picture this: a 73-year-old woman, a vibrant and beloved individual we will call Ella Lenina, passed away peacefully in her sleep. But what appeared on the surface to be a natural and gentle passing turned out to be something far more unexpected and complex upon closer review. It was not a singular heart attack or a conventional stroke in the way we typically understand them. Instead, it was the culmination of a gradual decline, exacerbated by a common mourning habit. A private act that, when performed improperly over time, placed an accumulating and unsustainable strain on her aging body. Her story is not intended to frighten you. It is meant to serve as a vital wake-up call. My name is DrLilyStones. I have dedicated more than 3 decades of my professional life to helping women just like you protect and nurture their well-being through every magnificent stage of life. And yes, that absolutely includes the deeply personal parts too. Today, I want to talk with you, woman to woman, about 7 surprisingly risky mistakes that many women unknowingly make during the practice of self-pleasure, especially in the quiet hours of the morning. These are mistakes that could quietly and insidiously affect your heart health, your pelvic integrity, and your delicate emotional balance over time. Before we begin, if you care deeply about your health and you wish to remain strong, vibrant, and profoundly connected to your body as you age, please take a moment to like this video, subscribe to our channel, and let me know in the comments if this message resonates with you. You are not alone in this journey, and these courageous conversations matter immensely. Let's begin with a habit that feels entirely natural but can inadvertently catch your body off guard. Mistake A1: stimulating too soon after waking up. Many women instinctively reach for a moment of personal pleasure right after waking. The house is quiet, the body is still enveloped in a state of rest, and it can seem like a gentle, comforting way to ease into the day. However, acting on that impulse too soon, before your body is physiologically prepared for the day, can be a risky proposition. You see, during the deep cycles of sleep, your blood pressure and heart rate are at their lowest points. As you begin to awaken, your entire cardiovascular system commences a slow, deliberate, and gradual transition into a state of alertness. Engaging in intense stimulation before your heart and your autonomic nervous system have fully stabilized can provoke sudden and significant spikes in both heart rate and blood pressure. According to the American Heart Association, such abrupt hemodynamic changes can place an undue strain on an aging heart, an effect that is particularly pronounced after menopause, when the natural elasticity of our blood vessels naturally declines. Some women report feeling dizzy, lightheaded, or even emotionally flat and disconnected afterward, without understanding the physiological reason. In more serious instances, these jarring episodes may contribute to underlying cardiovascular events, especially in individuals with pre-existing conditions. It is not just your heart that is affected. Your nervous system, too, is in a highly sensitive and transitional state in the early morning. Jumpstarting it with a sudden and intense flood of dopamine, the brain's primary pleasure chemical, can inadvertently set off a high-low cycle that ultimately leaves you feeling drained and depleted rather than energized and fulfilled. That is why I consistently recommend giving yourself a gentle buffer of 20 to 30 minutes after waking before you engage in any intense physical or emotional activity. Begin your day with hydration. Stretch your body gently. Allow your systems to acclimate to being awake. Then, if you choose to connect with yourself in this intimate way, your entire system will be far more prepared, both physically and emotionally, to receive and integrate the experience positively. This may seem like a small and insignificant change, but over time, it could be a crucial factor in protecting your stamina, your emotional stability, and the long-term health of your heart. Mistake B2: relying on overstimulating fantasies. The second mistake is one that a great many women never pause to question, especially within the privacy of their own minds. The practice of using highly stimulating fantasies or erotica to get into the mood. These may take the form of fast-paced, high-intensity storylines or idealized, unrealistic romantic scenarios. And while they may certainly feel exciting and effective in the moment, they can come at a significant cost, especially for women in their 60s and beyond. Here is what happens on a neurochemical level. Your brain responds to these intense, novel, and often extreme stories with a powerful surge of dopamine. However, over time, frequent and repeated exposure to this level of high stimulation material can begin to reduce your brain's natural sensitivity to real-life touch, emotional intimacy, and more subtle forms of arousal. According to recent and compelling research published in JAMA Psychiatry, a consistent pattern of overstimulation may contribute to a dulling of arousal thresholds, a sense of emotional flatness, and an increasing difficulty in connecting during real-life intimate moments. You may find that it becomes harder to respond to your own gentle touch, or that you feel emotionally distant from a partner. Even during moments of physical closeness, you may even begin to crave more extreme or novel mental stimuli just to feel something, inadvertently setting off a detrimental loop that further disconnects you from your own body and its authentic emotional needs. One of my patients, a vibrant and intelligent 67-year-old, once told me that she felt like she was watching her life rather than living it. When we looked closely at her daily patterns, we discovered that her morning routines were filled with a form of emotional disconnection that was masquerading as pleasure. Over time, this practice had left her feeling empty and unfulfilled, not empowered. Instead of relying on external stories, I encourage you to explore what is happening inside you. Use your breath as an anchor. Tune into the subtle sensations of your body. Recall warm, emotionally grounded, and authentic memories. Choose stimuli that feel genuinely nourishing and connecting, not overwhelming and disconnecting. Your brain and your heart will thank you for it. Mistake N3: holding your breath or straining during climax. Let's now talk about a habit that is so common. Most women do not even realize they are doing it. The tendency to clench their muscles, bear down with their abdomen, or hold their breath during the peak moments of climax. It may feel like an instinctive and natural part of the experience, but these movements create a sudden and dramatic spike in intra-abdominal pressure, something we refer to in medicine as the Valsalva maneuver. For women over 60, this sudden spike in pressure can place significant and repeated stress on your pelvic organs, your bladder, your uterus, and your rectum. If you have had children, or if you are post-menopausal, your pelvic floor muscles may already be in a weakened state due to natural hormonal changes and a loss of collagen. According to the Mayo Clinic, the application of improper strain during any form of physical exertion, which absolutely includes sexual activity, can increase your long-term risk for developing conditions like pelvic organ prolapse, where the organs descend from their normal position, or urinary incontinence. Some women also report experiencing a dull, persistent ache in the pelvis, a noticeable reduction in sensitivity over time, or a sensation of heaviness after climax. These are not just unavoidable age-related annoyances. They are clear physical signs that your pelvic muscles are being taxed more than they can comfortably and safely handle. So, what is the solution? The answer is conscious relaxation. Let go of the perceived need to push or force your way into a sensation. Instead, focus on your breath. Inhale and exhale fully and deeply throughout the entire experience. Allow your body to open and receive pleasure naturally, rather than attempting to force a certain level of intensity. A gentle climax is not a weak one, it is a wise one, and it is one that actively protects your long-term function, comfort, and pelvic health. Mistake point 4: skipping urination before and after self-stimulation. This next point may seem incredibly simple, but it is one of the most important and non-negotiable steps you can take for your intimate health, especially if you are prone to developing urinary tract infections, UTIs. Skipping a trip to the bathroom both before and after self-pleasure can inadvertently leave harmful bacteria lingering near the opening of the urethra, significantly increasing your risk of developing a painful infection. A woman's anatomy makes this practice even more critical. Our urethras are anatomically shorter than men's, which means that bacteria have a much shorter and more direct path to travel to reach the bladder. During any form of sexual stimulation, especially with the involvement of touch or a device, bacteria from the skin or surrounding areas can easily be moved toward the urethral opening. This is a common and preventable cause of infection that you can drastically reduce or even eliminate with this one small, mindful step. So, before you begin, empty your bladder. And when you are finished, empty it again. These moments of dedicated hygiene are not interruptions to your pleasure. They are profound acts of self-respect and self-preservation. Mistake point 5. Using too much pressure or aggressive stimulation. Let's now have a candid conversation about something few women openly discuss. Yet it stands as one of the most common causes of physical discomfort and loss of sensation later in life: the use of excessive pressure or overly intense, repetitive techniques during the act of self-pleasure. As you age, your body undergoes significant and beautiful changes. Your estrogen levels decline, particularly after menopause, which can lead to a condition known as vulvovaginal atrophy. This simply means that the delicate tissues of your vulva and vagina may become thinner, drier, and far more sensitive to any form of irritation. The nerve endings can become more fragile, and the skin itself may bruise more easily. Despite these natural changes, many women continue to rely on habits that were developed in their 30s or 40s, especially the use of powerful vibrators or very direct, repetitive stimulation on a single area. What may have felt pleasurable and effective in the past can now be quietly and unintentionally causing harm. I have had several patients who have arrived in my office with concerns of numbness, a significant loss of sensation, or even a persistent, burning discomfort during any form of intimacy. For many of them, the culprit was not an internal medical condition. It was external, repetitive trauma from overuse of high-intensity stimulation. One woman, a retired teacher named Carol, told me that she had gradually and progressively increased the setting on her vibrator over the years, mistakenly thinking that she needed more to be able to feel anything. What she did not realize was that the increasingly stronger vibrations were actually desensitizing her delicate nerves and potentially damaging the fragile blood vessels in the area. The unfortunate result was that it became harder and harder for her to feel pleasure, and at times, it became downright painful for her to even try. Remember, true pleasure is not about intensity, it is about connection. This means adopting a gentle, compassionate, and responsive approach. Always apply a high-quality, water-based lubricant and give your tissues ample time to respond and engorge with blood. Vary your technique and your location of touch. Avoid pressing directly and forcefully on the clitoris for extended periods. Take frequent breaks and consciously check in with how your body is feeling. Think of caring for your intimate health in the same way you would care for a beloved and priceless antique silk scarf. It is beautiful and resilient in its own way, but it was never meant to be scrubbed harshly. Respect your body, and it will return that respect with enduring comfort and lasting sensitivity. Mistake point 6: masturbating when you're feeling emotionally low or anxious. This mistake is subtle but profoundly important. Using the act of self-pleasure as a primary mechanism to escape from emotional discomfort can inadvertently create a draining and unhealthy cycle, especially for women in their 60s and beyond. If you have ever reached for a moment of physical relief when you were feeling lonely, anxious, stressed, or disconnected, please know that you are not alone. But it is also crucial to know that your emotional state matters just as much as your physical one when it comes to healthy intimacy. Here is why. During self-stimulation, your brain releases a powerful burst of feel-good chemicals, primarily dopamine and oxytocin. When this neurochemical event happens within the context of genuine self-connection and a state of emotional peace, these chemicals work to enhance your mood, support feelings of bonding, and genuinely lift your energy. However, when you are feeling emotionally off, for instance, anxious or low, those same chemicals may act more like a temporary, superficial bandage. The relief feels good for a fleeting moment, but afterward you may experience an emotional crash, leaving you feeling even more depleted than before. Several women have described to me that they felt unexpectedly sad, empty, or profoundly tired after a climax but could not understand why. When this pattern is repeated over time, it can lead to a pervasive sense of emotional flatness or even contribute to the symptoms of depression. According to a 2022 review published in Frontiers in Psychology, the emotional context of pleasure matters a great deal. Without a foundation of positive emotional grounding, the brain can begin to associate intimacy with a feeling of isolation rather than one of fulfillment. So, before you engage in self-pleasure, take a moment to gently check in with yourself. Are you reaching for comfort, for distraction, or for a genuine connection with your own body? If you are feeling low, consider exploring other soothing actions first. Take a walk in the fresh air, call a friend, practice some calming breath work, or even write down your feelings in a journal. Your emotional health and your physical pleasure should never be at odds. When they are beautifully aligned, your entire experience becomes more healing, more integrated, and far more satisfying. Mistake phase 7a. Ignoring the subtle signals your body sends. The final mistake may be the most dangerous of all. Not because of what you are actively doing, but because of what you may be passively ignoring. It is so easy to brush aside the little discomforts we experience as just normal aging. Maybe it is a bit of persistent dryness, a dull ache after intimacy, or a feeling of heaviness in the pelvis that you did not used to have. Perhaps your climax feels less intense than it once did, or your recovery time seems longer. These subtle but significant shifts are your body speaking to you. And yet, far too many women assume that these changes are simply inevitable and consequently fail to bring them up with their doctor. In reality, these are often the early, whisper-like signs of deeper, addressable issues: a weakening of the pelvic floor, imbalances in the urinary tract, the thinning of vaginal tissues, or even subtle changes in nerve function. All of these conditions have early symptoms that are easy to dismiss, but are absolutely essential to address. I once treated a woman in her late 60s who had been experiencing discomfort for nearly a full year before she came to see me. By the time she did, what had begun as mild dryness had unfortunately progressed into recurring infections and a near complete loss of physical sensitivity. She told me, her voice filled with regret, "I just thought I was getting old." But aging does not have to mean silent suffering. Please, if something does not feel right, no matter how small or insignificant it may seem, listen to that feeling. Bring it up at your next wellness visit. Ask questions. Seek help. You deserve comfort, you deserve clarity, and you absolutely deserve to feel fully and vibrantly alive in your own body. Your body is incredibly wise. It whispers before it shouts. And if you learn to tune in early, you can prevent many of the challenges that older women so often face in silence. Let's take a step back for a moment and reflect. Everything we have discussed so far points to one central, undeniable truth: your body is always communicating with you. Whether it is through a sensation of tension, a feeling of discomfort, or even a fleeting sense of emotional flatness, these signs are not random. They are gentle alerts. They are your body's intelligent way of asking for a little more care, a little more patience, and a little more wisdom. And now, let's bring this all into focus with one clear, overarching message. Masturbation itself is not the problem. It is not something to ever feel ashamed of. In fact, when it is practiced mindfully and with intention, it can be a beautiful, nourishing, and healthy expression of self-awareness and vitality. But like so many things in life, it is not just what you do. It is how, when, and why you do it that ultimately determines whether it supports your holistic health or slowly chips away at it. You have now seen how 7 common mistakes, each one subtle on its own, can accumulate and add up over time. And none of them are about shame or wrongdoing. They are about awareness. Let's bring this all together with a perspective that I share often with my patients: the profound power of mindful self-care in later life. Aging brings about change, yes, but it also brings with it an incredible depth of wisdom. And with that wisdom comes the precious opportunity to reframe your entire relationship with your body, with your pleasure, and with your health. Just as you would not exercise with the same intensity as you did in your 30s or eat without any consideration for your digestion, the way you care for your intimate health must also evolve. Every moment of self-pleasure can become a gentle check-in, a way to understand how your body is truly doing. Is your tissue more sensitive today? Are you feeling present and embodied? Or are you emotionally distracted? Is your heart racing a little too fast? These observations are not interruptions to the experience, they are valuable data points. They are there to guide you. And when you begin to use this insight, something incredible starts to happen. You begin to feel connected again, not just to a physical sensation, but to your whole self. The act itself becomes less about a simple release and more about a profound renewal, less about an escape and more about a deep awareness. That fundamental shift in mindset, from routine to ritual, is where true and lasting health resides. The National Institute on Aging emphasizes that emotional and physical wellness are deeply and inextricably intertwined in our later years. Pleasure, when it is experienced mindfully, can stimulate the nervous system in ways that support our immunity, our heart health, and even our cognitive function, but only when it is in perfect harmony with our body's true and present needs. Replacing habits with healing practices. Now that we have walked through the 7 common mistakes, I would like to offer you some positive, actionable steps you can take instead, gentle alternatives that are firmly rooted in care and wisdom. First, create a calming environment. Whether you begin your morning with some deep breath work, light stretching, or a soft instrumental playlist, allow your nervous system the time and space to gently ease into the day. Think of this as a warm-up for your entire being. Not just your muscles or your breath, but your emotions too. Second, prioritize lubrication. This is not just about enhancing comfort, it is about providing protection. Vaginal and vulvar dryness is incredibly common after menopause, and using a high-quality, water-based lubricant can help to protect the delicate tissues from tears and the subsequent discomfort they can cause. The American College of Obstetricians and Gynecologists, ACOGA, recommends it as a first-line support for intimacy in post-menopausal women. Third, adjust your stimulation style. If you have used the same technique for years, consider exploring slower, more responsive, and varied movements. You may find that your body now prefers something entirely new. Try gentle, circular motions, indirect touch around the clitoral area, or incorporating your breath awareness into your routine. The goal is not to chase a certain level of intensity, but to feel deeply and fully, on your own terms. Fourth, stay hydrated and be meticulously hygienic. Drink a glass of water before and after. Wash your hands and any devices you may use with a fragrance-free, non-irritating soap, and always urinate both before and after to protect your delicate urinary tract. Fifth, listen to your emotions. If you are feeling low, tense, or lonely, consider connecting with someone you trust before turning inward for physical release. A short walk, a 5-minute gratitude meditation, or a warm and comforting conversation may better serve your nervous system in those vulnerable moments. Finally, document your experiences. Keep a small, private journal. Write down how you felt before, during, and after. This is not about being clinical, it is about learning from your own body. You will begin to see patterns. You will notice what energizes you and what leaves you feeling flat. And that profound awareness will help you to make wiser, more self-loving choices over time. A story from the heart. Let me share one final story. One of my longtime patients, a woman named Marian, came to me at the age of 68 feeling confused and a little embarrassed. She said, "Dr. Stones, I used to feel so alive in my own body, and now I just feel disconnected." We talked. She had been going through the motions of self-pleasure purely out of habit, not out of any sense of joy. She rushed through her mornings. She was not checking in with herself emotionally. And over time, she had started to feel more isolated and more anxious, even though she could not pinpoint exactly why. We made a series of small, gentle changes. She started journaling for a few minutes after her morning routine. She began to wait 30 minutes after waking before engaging in any stimulation. She bought a gentler, higher quality lubricant and consciously changed her breathing pattern during the experience. Within 3 weeks, she told me that she felt more vibrant, more attuned to herself, and surprisingly, more energized throughout her entire day. This is the incredible power of gentle, mindful attention. Not discipline, not shame, but profound awareness and compassionate care. Redefining pleasure after 60. As women, we are often taught that our own pleasure is optional, or worse, that it is somehow selfish or inappropriate in later life. But nothing could be further from the truth. The ability to experience pleasure, connection, and joy is an integral part of your vitality. It is a sign of life, a sign of health, and a sign that you are still here, still capable, and still so very deserving. You do not have to approach these topics with fear. With the right knowledge, you can approach them with strength, with peace, and with unwavering confidence. And that is what this conversation is truly about. In part 4, we will wrap up everything we have learned with clear, empowering steps to move forward, plus a warm reflection to guide your next chapter with abundant hope and strength. You have made it to this point, and that matters. It tells me something incredibly important about you. You care about your health, your future, and your sacred connection to your own body. That willingness to listen, to learn, and to grow, that is a strength that not everyone possesses. So please, take a moment to acknowledge yourself for simply being here, because what we have explored together goes far deeper than just a list of health risks. It is a heartfelt call to return to yourself with care, with patience, and with profound dignity. As we bring this important conversation to a close, let's revisit the very heart of what we have uncovered. Masturbation is not something to feel any shame over. In fact, according to the North American Menopause Society, when it is practiced mindfully, it can improve circulation, help to maintain vaginal health, reduce stress, and even support better quality sleep. But like any wellness practice, the how matters just as much as the what. The 7 mistakes we discussed: stimulating too soon after waking, relying on over-stimulating fantasies, straining during climax, skipping urination, using too much pressure, self-pleasuring while emotionally off balance, and ignoring your body's subtle warnings. These are not moral failings. They are simply gaps in awareness. And awareness is something that you now possess in abundance. From awareness to action, so what happens next? This is where real change begins, quietly and gently. Not through any radical transformation or lofty, unrealistic resolutions, but through the small, daily choices that are made with a deep and abiding respect for the woman you are right now. Start by making one simple shift. Maybe tomorrow morning, you will wait 30 minutes before any form of stimulation. Or maybe you will simply hydrate first. Maybe you will choose a gentler, more curious rhythm, or pause to reflect on how you are feeling emotionally. That one single change is enough to begin the process of restoring the delicate and beautiful balance between your physical self and your emotional well-being. Then, over time, let those positive changes build upon each other. Add a high-quality lubricant to your routine. Pay close and loving attention to how your body responds. Keep a private health journal. And please, talk to your doctor if something feels off. These are not burdens, they are powerful tools. Tools that help you to take control of your own health without fear, without shame, and without confusion. You are not alone. One of the greatest and most damaging myths that women over 60 face is the belief that they are the only ones going through this. That no one else is wondering if things down there have changed. That no one else feels disconnected, uncertain, or just plain frustrated. But you are not alone. Every single week, I sit with women from all walks of life: nurses, grandmothers, teachers, business owners, and caregivers, who are all navigating these exact same questions. They are strong, smart, capable women who have spent decades of their lives taking care of others. And now, they are finally ready to learn how to care for themselves. The truth is, aging does not mean disappearing. It means evolving. And you are absolutely allowed to bring your curiosity, your questions, and your needs into every single stage of that magnificent evolution. A gentle reminder from Dr. Stones: after more than 30 years in the field of women's health, here is what I know for sure: your body is still on your side. Even after 60, even after menopause, even if it feels unfamiliar at times, your body still responds to kindness. It still responds to gentle touch, to rest, to nourishment, and to compassionate care. But it can only do that if you truly listen, if you stop rushing, if you replace judgment with curiosity, and if you replace criticism with compassion. You have spent your life showing up for others. Now is the time to show up for yourself, not in big, dramatic ways, but in the quiet, sacred moments. The breath you take before reaching for stimulation. The glass of water you sip when you wake. The courageous choice to pause when something feels off. That is how true healing begins. Not with pressure, but with presence. Looking ahead with strength and grace. So, what do you take with you from this conversation today? You take with you the knowledge that pleasure is not behind you. It is still available, but it may look and feel different now. It asks for more patience, more breath, and more awareness. And in return, it offers something even deeper than before, a sense of confidence that does not depend on youth, but on profound wisdom. You take with you the understanding that your health is not just physical, it is emotional, it is relational, and it is entirely within your reach. And you take with you the comforting reminder that you do not have to go through this journey alone. Our Elderwear Wellness community is here for you with trustworthy guidance, supportive tools, and a compassionate, listening ear. If something in today's conversation resonated deeply with you, if even one single moment made you feel seen and understood, I warmly invite you to take the next step. Leave a comment below and share one insight you are taking with you. It could be a gentle habit you intend to change or something new you have learned. Your words might just be the encouragement that helps another woman who has been carrying these same questions silently. And if you would like more evidence-based wellness tips that are specifically tailored for women like you, please consider subscribing. We talk about the real things here, without shame, without judgment, and always with care. Above all, please remember that your next chapter can be your strongest yet. Let's walk into it together with clarity, with wisdom, and with a renewed and beautiful connection to the woman you are still becoming.